Hi everyone, welcome to ResearchMD.com. My name is Dr. Pramil. I work as a Chief Medical Officer in one of the biggest hospitals in the United States, also an Associate Professor of Medicine in one of the largest medical schools also in the United States. Today our topic is going to be about turmeric. Everyone knows about turmeric, right? Yes, benefits are so many properties of turmeric. When you look at turmeric, it's actually introduced in the Ayurvedic medicine thousands of years ago. It's also used in Siddha medicine, it's also used in Chinese medication. But the property of the turmeric is actually coming from that compound called curcumin. Okay, turmeric contains around 6% of curcumin, and if you look at it, if you get like a 1 teaspoon, you can have around 200 milligrams of curcumin in one teaspoon of turmeric. Okay, now what are the benefits of turmeric or curcumin? Many benefits. Again, lots and lot of randomized control studies done in the past. Remember that. Main thing, you got antioxidant properties, which can prevent cancer and any kind of inflammation it would help. And the other thing is like anti-inflammatory, which we say like you got properties against arthritis and even known to improve the metabolic syndrome, which is a combination of high cholesterol, body weight. Again, I don't have to say many benefits. You already probably know about the benefits of curcumin. But today's topic is not about the benefits of turmeric. We are going to look and see what are the complications of taking turmeric. What can you expect? Those are the main topic today. So let's look at the scientific study. All of our presentations are based on scientific study, right? So first thing we have to do is look at the scientific literature before we talk about. That's the main purpose of our channel, is to bring scientific studies for your benefit. So, rather than kind of talking about, when you look at YouTube videos, many of them, you have like chiropractors or not even regularly trained doctors giving advice. So it's important to look at the scientific, scientific proof for anything we talk about it, okay? So the first study we're going to look at today is published in the BMC, and it's looking at the dose escalation of curcumin formulation. Great study. And let's see what these people found out about the side effects of curcumin. So in this study, they looked at it. You can have, based on the dose effect, you can have side effects, okay? Let's say if you start with you take 1,000 milligram, what can you expect? Diarrhea. So one of the common complications you can have is diarrhea. Then when you increase the dose, maybe you're taking like 4,000 milligram, you can have headache. And then when you go to 8,000 milligram, you can have a rash, and your stool color can kind of change into yellow. And then, it can go up to 10,000. You can headache, nausea. Those are the main complications they found in the study. Again, let's look at it. You can have diarrhea, you can have headache, you can have rash, and your stool can turn into yellow. Those are the main, the main complications or main side effects. Depends upon the dose. If you increase the dose, you will see many of these effects. Okay, and there was another study, which is like a phase 1 clinical trial, published in the Cancer Clinical Research. In this study, they also found patients having diarrhea. But another important thing is, when they looked at the lab, 2 lab values have gone up. One is alkaline phosphatase and the LDH, lactate dehydrogenase. Again, it's very important. 2 lab values. Which one are they? Alkaline phosphatase and LDH, which is lactate dehydrogenase. Okay? So, based on the scientific studies, like what can we say? We can say, curcumin or turmeric have some side effects you can expect, okay? So what are they? Diarrhea, headache, rash, yellow stool. Okay, 2 main lab abnormalities you're going to see is increased alkaline phosphatase, and also you can have LDH or lactate dehydrogenase. So how does it helpful to us? So anytime you start taking the medicine, you want to know like what was going on, right? And if you develop some complication, you can come back and check, hey, maybe this is happening. You don't have to stop all the medication, but at least it give you an understanding. A lot of times I see patients and they come in and I ask them, are you taking any herbal medication? And I get the lab results, and some of the lab values can be like, out of proportion. So I will ask them, what medications are you taking? Most people I have noticed is taking some kind of herbal medication in the United States. So it's important to know what are the expectations or what are the side effects you can take from any herbal medication. And today we focus also on turmeric. Thanks so much for watching. We'll be back with another presentation. God bless. Thank you.